Today I'm going to be talking to you about something very important: dengue fever. This is a disease that affects millions of people every year, especially in tropical and subtropical regions. You may have heard of it before, but do you know what it is exactly? How it spreads and how we can prevent it? Well, let's break it down. Let me break it down in a simple way. First, what is dengue fever? Dengue is a viral infection caused by the dengue virus, which is transmitted by mosquitoes. The main culprit is the aegypti mosquito, through though another species, Aedes albopictus, can also spread it. This disease is common in places with warm climates like Asia, Africa, South America, and even some parts of the Middle East. Now, let's talk about how it spreads. Dengue doesn't spread directly from person to person, like a cold or the flu. Instead, it spreads through mosquito bites. When a mosquito bites a person who already has dengue, the virus enters the body. Then, when that same mosquito bites another person, it passes the virus to them. Now, this is why dengue cases are rising during rainy seasons, because there are more mosquitoes around that still water. What are the symptoms of dengue? Symptoms usually appear 4 to 10 days after a person is bitten by an infected mosquito. Some common symptoms are high fever, severe headaches, pain behind the eyes, muscle and joint pain, which is also why dengue is sometimes called breakbone fever, skin rash, and nausea and vomiting. In some severe cases, dengue can also turn into dengue herogatic fever or dengue shock syndrome fever, which can cause bleeding, organ failure, and even death. This is why it's important to recognize symptoms early and seek medical help. How can we prevent dengue? There's no specific treatment for dengue, so prevention is the best strategy. Here are some ways we can protect ourselves. Avoid mosquito bites. Wear long sleeve clothing, especially during early morning and late afternoon, because this is when mosquitoes are most active. Use insect repellent. Apply mosquito repellent on exposed skin. Another one is eliminate mosquito breeding sites. Aedes mosquito lay eggs in stagnant water, and make sure to empty and clean water containers like flower pots, buckets, and old tires. Use mosquito nets and screens. These can keep mosquitoes out your home. Support community efforts. Government and health organizations often spray insecticides to control mosquito populations. Supporting these programs can help reduce dengue cases. What should you do if you think you have dengue? If you experience any of one of those symptoms, the best thing to do is see a doctor immediately. Drink plenty of fluids, get rest, and avoid painkillers like aspirin, as they can increase the risk of bleeding. Your doctor might recommend paracetamol to help with fever and pain. Final thought. Dengue is a serious disease, but with the right precautions, we can reduce its spread. By protecting ourselves from mosquito bites and keeping our environment clean, we can help prevent dengue outbreaks in our communities. Thank you.